Emerging research on the gut microbiome suggests that the foods we eat, particularly snacks, do more than satisfy cravings. They can shape metabolic health, influence insulin sensitivity, and modulate inflammation, all of which have implications for public health. At the population level, dietary patterns that favor processed, refined snacks high in sugar and low in fiber may contribute significantly to the rising prevalence of prediabetes and type 2 diabetes. Conversely, simple swaps, such as replacing refined bedtime or mid-afternoon snacks with fiber and polyphenol-rich whole foods like pistachios, nuts, berries, or legumes, have the potential to promote SCFA-producing bacteria, stabilize glucose, reduce inflammatory signaling, and support satiety. These microbial-mediated benefits suggest that even modest changes in habitual snacking could cumulatively influence national diabetes risk over time. Epidemiological data show that dietary quality is closely linked to diabetes prevalence. Diets high in ultra-processed foods correlate with increased fasting glucose, insulin resistance, and systemic inflammation, whereas diets rich in whole plant foods, healthy fats, and fiber are associated with improved glycemic control and lower risk of type 2 diabetes. The microbiome offers a mechanistic explanation for these associations. Beneficial gut bacteria ferment fiber and polyphenol into short-chain fatty acids, SCFAs, like butyrate, propionate, and acetate, which improve insulin sensitivity, enhance gut barrier integrity, and regulate metabolic signaling in the liver, muscle, and adipose tissue. At a population scale, shifting dietary patterns to consistently provide substrates for these protective microbes could reduce the prevalence of insulin resistance, a key precursor of diabetes. Targeting snack habits may be a particularly practical and high-impact strategy. Snacks are frequent, often unplanned, and usually nutrient-poor, contributing disproportionately to refined carbohydrate and sugar intake. A nationwide reduction in processed snack consumption, replaced with whole food alternatives, could have cumulative effects on the microbiome across millions of individuals. Even small changes, such as a handful of pistachios instead of a cookie or refined cracker, deliver fiber, protein, healthy fats, and polyphenol that feed SCFA-producing bacteria, enhancing gut and metabolic health. In repeated cycles, these microbiome-mediated improvements in glucose regulation and inflammation could translate into measurable reductions in prediabetes progression and new diabetes diagnoses. Population-level interventions informed by microbiome science could be multifaceted. Public health campaigns might focus on education about the benefits of fiber dash, polyphenol dash, and nutrient-rich snacks, emphasizing microbial and metabolic effects rather than just calories. Policy initiatives could incentivize the production, affordability, and accessibility of whole food snacks like nuts, legumes, and fresh fruits. School programs, workplace wellness initiatives, and community nutrition efforts could incorporate microbiome-informed guidelines, creating habitual patterns that reinforce gut-friendly snacking from childhood through adulthood. Over time, these cumulative changes could shift national dietary patterns toward a microbiome-supportive profile, reducing diabetes incidence and associated healthcare costs. Importantly, microbiome research also underscores the potential for personalized approaches to complement population strategies. While general public health recommendations can encourage fiber and polyphenol-rich snacks, stool-based or gut microbiome-informed screening could identify individuals at higher risk of insulin resistance or prediabetes who might benefit from targeted interventions. For example, individuals with low abundance of SCFA-producing bacteria could be advised to integrate pistachios, legumes, or berries more strategically to optimize microbial-mediated metabolic benefits. Combining population-level policy with individualized guidance represents a powerful synergy, maximizing both reach and efficacy in diabetes prevention. Moreover, shifting snack habits is a feasible and culturally adaptable approach. Snacks are embedded in daily routines, often eaten multiple times per day, and do not necessarily require full meal planning or complex behavioral changes. Replacing processed, high-sugar snacks with microbiome-friendly options like pistachios offers an accessible entry point to healthier patterns, with immediate benefits in satiety, blood sugar stabilization, and microbial support. Over months and years, these incremental changes accumulate, influencing both individual risk and broader public health outcomes. At a systems level, Reducing refined snack consumption and promoting microbiome-friendly alternatives could impact the prevalence of other chronic diseases associated with insulin resistance, including cardiovascular disease, obesity, and non-alcoholic fatty liver disease. The gut microbiome functions as a central mediator in these processes, translating dietary inputs into metabolic and inflammatory signals. By prioritizing snacks that enhance beneficial microbial activity, public health strategies can leverage the microbiome as a scalable, modifiable factor in chronic disease prevention. In summary, the implications of microbiome-based nutrition research extend far beyond individual dietary choices. Even modest changes in snack habits, such as replacing refined, sugar-laden snacks with fiber, polyphenol, and nutrient-rich foods like pistachios, have the potential to support SCFA-producing bacteria, reduce inflammation, stabilize glucose, and improve insulin sensitivity. When scaled across populations, these habitual snack improvements could contribute meaningfully to the prevention of prediabetes and type 2 diabetes, demonstrating that microbiome-informed dietary strategies are not only scientifically compelling but also practical, cost-effective, and highly relevant for public health. By translating microbiome insights into actionable snack-based interventions, societies have a tangible opportunity to harness the power of whole foods to reduce national diabetes risk and promote metabolic resilience at scale.